My name is Dr. Maz. I'm a doctor at the Neuropathy Treatment Center of New Jersey. We are a panel of doctors and physical therapists working together at one location. I'm author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Methods for Resolving Neuropathy and Restless Legs. The reason you're watching this video is because you or somebody else is suffering with peripheral neuropathy. The purpose of this video is to inform you and enable you so you can live longer, so you can enjoy life with your family and friends to the fullest. Let's discuss peripheral neuropathy. Peripheral neuropathy is a term. Peripheral means arms and hands, legs and feet. Neuropathy means the nerves that are not functioning the way they are supposed to. They're degenerated. They're not working properly. And this has some symptoms associated with it, such as burning, tingling, numbness, pain, or sometimes patients, they say funny sensations to your arms or your legs. You may have had sensitivity to the sheets. Those are symptoms of restless legs syndrome. I have had hundreds of patients with neuropathy. I have had numerous patients who told me their stories and they're heartbreaking. I had a patient come to my office with her child on her lap. She said, Dr. Maz, I've heard about you and I'm ready to kill myself. I'm hopeless.
I came here feeling awful, and that doesn't even describe it. If I could say I thought it was hell, I would say that. Now I feel great.
After 3 days, I'm feeling fantastic. I can walk, I can smile, and I can climb up the stairs.
He helps people eliminate pain and prevent long-term, very disabling scenarios. This is Joel Bauer. I believe in Dr. Maz.
What if I tell you there is stuff that you're going to learn that pharmaceutical companies don't want you to know? What if I tell you there is a painless, non-invasive, non-surgical method for possibly and potentially getting rid of your neuropathy? We're going to go through that. The causes of neuropathy. Causes of neuropathy could be many things. Could be metabolic, could be neurological. Diabetes is a common cause. Have you heard of diabetes neuropathy? When there is high sugar level, it could cause diabetic neuropathy. Chemotherapy. People who have had chemotherapy or people who are on chemotherapy, they develop peripheral neuropathy. If you're on cholesterol medication, if you have been on cholesterol medication, this is a big controversy, even if you need to be on cholesterol medication, which is not the topic of this DVD. Cholesterol medication, statin drugs, there is numerous research, they could cause peripheral neuropathy, contrary to what a lot of doctors believe are. Cholesterol medication, it could cause muscle spasm and peripheral neuropathy. You may develop autoimmune condition. You may have autoimmune condition in your body that is causing you not to get better with the treatment that you're on now or even our treatment. So that is why we have to see metabolic and neurological cause. If you have food sensitivity or an autoimmune condition, that could be attacking your nervous system. Has anybody told you that? I doubt it.
I would definitely recommend this to anybody.
I am pain-free.
At this time, I could sleep all night, through the night, without pain meds. I don't use the cane. I just can't believe the difference between my condition when I came in and today.
I have studied over 10 years of latest research in diagnosis and treatment of neuropathy. There are only a handful of selected doctors in the northern United States who are trained and certified by the Neuropathy Treatment Centers of America who can provide the exam and the treatment that we do in this office. I'm also trained by the country's leading expert in peripheral neuropathy, and that's Dr. Michael Johnson. What makes us different is we treat you and diagnose you metabolically and neurologically. We don't leave any stone unturned. We investigate the true cause. We define what is the actual cause of your problem. We design a diagnostic treatment that is done on-site to find the underlying cause by proper diagnosis. We deliver a treatment that is second to none, that is painless, non-invasive, non-chemical, non-surgical. There are certain lab tests that you need to be doing for proper assessment of peripheral neuropathy. So let's talk about the metabolic diagnosis of peripheral neuropathy, then we go to neurological aspect of it. The first is blood test. Blood test, we have to do a complete blood panel, lipid panel, thyroid panel, metabolic panel, and blood chemistry, and a couple of other factors to see what is going on with your body. Now, I want you to understand, you may say, I've had all the tests, they're all negative. I see that all the time, I hear that all the time. I want you to understand, there are lab ranges assigned by the lab company like LabCorp and Quest, and there are functional ranges that we need to assess. Functional ranges, they're a lot narrower than the lab ranges that they give. So just because your number is within the range, that doesn't mean it's normal. We look at it closely. So if you make an appointment to come in, bring the lab results as well, everything that you have. You may have food sensitivity test. You may be allergic to gluten, dairy, egg, milk, soy, or yeast. We may prescribe this for you. Gluten is a key factor. A lot of people are allergic to gluten they don't even know about. Another common patient response is, I'm not allergic to any food. Well, you're not the judge of that. The only way to test it is to test it. The only way to know that you're allergic is to test it. Our doctors may prescribe for you adrenal stress index. Now that's a very good and imperative test to be done on majority of our patients. Why? Well, let's see. Adrenal glands, they're on top of your kidneys. Their job is to manage cortisol production. Now cortisol is a hormone in your body. What happens, cortisol should be at its highest in the middle of the day, about 3 p.m., and at its lowest at 3 a.m. in the middle of the night. Cortisol is in charge of your rest and fatigue as well. So what happens, a lot of patients who cannot sleep at night, who are fatigued in the morning, when they get up, they don't have a restful sleep, it could be because of their adrenal glands malfunction or under tremendous amount of stress. So what happens, the cortisol level could be highest in the middle of the night, and that's why you can't sleep. And that's why medications that you take, it aids you to sleep, but if one day you don't take it, you can't sleep. And you have to go higher and higher in the dosage. I guarantee you, you have not had all the tests that are necessary to do, at least out of hundreds of patients that we have seen at Neuropathy Treatment Center of New Jersey, we have never seen a patient that had all the necessary tests that needed to be done. And I guarantee you, if you come in, you're going to hear stuff that you have never heard before. Because of many factors. Because of pharmaceutical companies don't want you to know. What if I tell you pharmaceutical companies, they're not necessarily your friends? I don't want to get into that topic. You may have H. pylori. You may have a leaky gut syndrome. All of these factors have to be assessed before we go on with proper treatment. Now, you may get treatment the same first day because the initial phase of treatment is common and it's usually the same for all patients that they're coming in.
Dr. Maz is one of the most caring, compassionate people that I've ever met.
He not only treated me in a very specific and loving way, but he also educated me on many of the health issues that I was having.
I'm out of the severe pain zone. I'm now free of taking oxycodone.
Dr. Maz transformed my life in just a few minutes.
Let's go to neurologic aspect of testing of peripheral neuropathy. We do a small fiber neuropathy exam of your peripheral nerves. We do test your response to light touch, vibration, cold, hot, pinprick, and a couple of other sensations to see what is going on with your small fiber nerves. We also do nerve conduction velocity testing to test the large fiber nerves. We do brain screening with different neurological maneuvers, eyes open, eyes closed, put feet together, finger to nose test, couple other tests to see if you have any neurological sway. Those are indicating factors that the problem may be coming from your brain, not that you have a brain damage, it's physiological. Okay? We may have to do vascular testing. Our doctors order vascular testing to see if you have enough circulation to your arms or your legs. If you don't do vascular testing and the problem could be a vascular issue, you're not going to respond to care. And that is why you have been going to doctor to doctor to doctor to keep the medication, increase the dose, or change your medication. So how do we treat peripheral neuropathy? We treat peripheral neuropathy metabolically and neurologically. Most likely you have been given medication for your neuropathy. Neurontin, Lyrica. Those are anti-seizure medication. They're given to you off-label. I'm not telling you to stop taking those medications. I'm just telling you to be informed. You can Google and yourself and find out. Those are anti-seizure medication, and as a side effect, they manage neuropathy. You may even need orthotics. Orthotics is important if you have improper foot biomechanics. It's going to cause problems. You're not going to get better. We have to look at the structure of how you walk and test your gait. We have a foot scan in this office which makes 100% customized orthotics for your feet if you need it. So ask yourself this: how has your condition affected you, your family, your children, your relationships? Is it affecting your lifestyle? What is it costing you not to get the treatment? What is it costing you not to be able to do what you want to do? Where do you picture yourself in a year from now? Where do you picture yourself in 3 years from now? In 5 years from now? You think it's going to get better by itself? If you're serious about getting your peripheral neuropathy handled, our office is for you. Call 201-848-8000. Not everyone is accepted for care. We only accept the patients who we feel we can help. If what we have said to you has made sense to you, then you need to call our office, and one of our new patient coordinators will be glad to take your call. When you come to our office, you may get treatment the same day or the next visit. We don't know. We have to assess. Unless you're coming from out of the state, then you're going to get treatment the same visit. If you want to give yourself a chance for a painless, non-invasive, non-surgical, non-chemical treatment method, give our office a call. Can we guarantee it? No, we cannot guarantee anything in the medical field. Are we successful? Yes, very successful. I will look forward to seeing you in the future. You can call our office at 201-848-8000. Yes, we accept most insurance plans, and God bless.